This is the conduction pathway. On the superior aspect of the right atria, you have your SA node, or sinoatrial node. The inferior aspect of the right atrium, we've got the AV node, or the atrioventricular node. And the conduction is going to go from there to there, and it's going to go to here. At the top of the interventricular septum, it's going to be the bundle of His, or just the interventricular node, atrioventricular bundle. And it's going to go from there down here, which are called bundle branches. The bundle branches are going to go to Purkinje fibers. So once again, to clarify, SA node on the superior aspect of the right atria, AV node, atrioventricular node on the inferior aspect of the right atria, to the atrioventricular bundle, or the bundle of His, bundle branches, Purkinje fibers. And that's the conduction pathway of the heart. Now we're going to the blood pathway. So blood is going to enter the heart through the inferior or the superior vena cavus. Both of these are. You're going to deposit blood into this, which is the right atrium. And it's going to go through the right atrioventricular valve, or the tricuspid valve, into the right ventricle. The right ventricle is going to send blood through the pulmonary semilunar valve to the pulmonary artery, which branches off into the lungs. And that's where the blood gets oxygenated because it's deoxygenated. So the oxygenated blood is going to be sent back from the lungs to the heart via the veins. These are the pulmonary veins. And it's going to go on both sides, because there's two lungs, into the left atrium. And from the left atrium, it's going to go through the bicuspid valve, or the left atrioventricular valve, to the left ventricle. The left ventricle's got a lot of muscle on it, which means that it's going to contract. It's going to have to send that blood all throughout the body. The right ventricle does not have as much muscle because it sends blood only to the lungs. The left ventricle has a lot of muscle and is very strong because it goes to the entire body. And so it's going to flex, and it's going to send the blood through this guy right here, which is the aortic semilunar valve, which is going to go through the aorta to the rest of the body. So once again, we're going to go blood, once from the aorta to the rest of the body, it's going to get deoxygenated after it gets used up. It's going to come back to the heart via the superior inferior vena cava into the right atrium, through the tricuspid to the right atrioventricular valve, into the right ventricle, through the pulmonary semilunar valve, to the pulmonary artery, to the lungs, coming back through the pulmonary veins to the left atrium, through the bicuspid valve, which is the left atrioventricular valve, down to the left ventricle, which is going to go through the aortic semilunar valve to the aorta, to the rest of the body again.